The NFL playoffs are better with FanDuel because right now new customers can bet $5 and get $200 in bonus bets, guaranteed. That's $200 in bonus bets, win or lose. FanDuel, an official sportsbook partner of the NFL. 21 plus and present in select states. First online real money wager only. $5 first deposit required. Bonus issued as non-withdrawable bonus bets which expire 7 days after receipt. Restrictions apply. See terms at sportsbook.fanduel.com. Gambling problem? Call 1-800-GAMBLER.
The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover.
Hey all, Jonathan from Go2Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors, mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go2Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code Go2Health at checkout. That's code Go2Health at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
Welcome to Go2Health Radio with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. And now, here is Jonathan Marks.
Hello, everyone. This is Jonathan Marks, and welcome back to Go2Health Media. I'm very happy today to be talking about Medicare and managed care services. And we have 2 experts on the show from LevelHCS Services. Their website is LevelHCS.com. And I'd like to introduce Levi Chris, who's the Chief Executive Officer, and also Eric Chiembakeza, who's the Chief Innovations Officer of LevelHCS Services. And just a little background on Levi first. He's the CEO for LevelHCS Solutions. He has an extensive background in the service and technology industries, including various leadership roles with Electronic Data Systems, Hewlett-Packard, Med Synergies, which was acquired by Optum 360, and also Oculus Health. Throughout his career, Levi has focused on solving industry challenges with the application of best-in-class solutions to meet needs of the clients. Levi has a diverse background with experience in technology integration and service management and strategic sourcing. His partner, Eric Chiembakeza, is the Chief Innovations Officer of Level and has spent most of his career working with federally qualified health centers. He's been involved in program development and management, infrastructure improvements, workforce development, and serving as both CFO, Chief Financial Officer, and Chief Operating Officer of different healthcare centers. In 2018, Eric founded Qualic Health, a consulting firm with a focus on helping clients make informed decisions and maximizing their potential. So welcome to the show, Levi and Eric. It's wonderful to have you. How are you today?
Doing well. Glad to be here, Jonathan.
Doing very well. Very well. Thank you.
Good. And I'm in Las Vegas. And Levi, you are located where?
I'm in Dallas.
Dallas, Texas. And Eric in
South Florida, Fort Lauderdale.
South Florida. Okay, so we've got a national group going on here. That's great. So what I'd like to start out our discussion with is really to talk about managed care services so that people understand what that is And I'll turn it over to you guys to kind of give us an overview of what managed care services are.
All right, I'll start out here. Managed care services are programs that Medicare has established to help providers and patients focus on patient-centered care. Okay, and so all of these programs and the efforts that we engage in are really to provide some tools and support for patients to execute the patient-centered care. And so it's a partnership with the provider, the patient, as well as us in supporting that patient. The programs are focused on care plans established by the provider and the patient, and we're here to help support those actions.
Got it. So let's take an example. If, let's say, someone on Medicare has diabetes and the doctor can provide a certain level of service, but what levels of service do you provide that are of assistance to the professional office?
So as Levi mentioned, the provider, the patient's PCP or primary care provider would essentially establish a care plan for and with them. So if they have diabetes, for example, in the office is relatively simple to kind of address certain issues that may show up, right? But overall, people don't spend most of their time in their provider's office. Most of the time is spent, at home or, going about their daily activities. So what the care management services do is essentially provide a bridge between those visits, right? So what happens after a patient leaves the office? Any number of things can happen. So what we do is we want to ensure that whatever care plan was established with that patient is more easily adhered to for that patient.
Great. And I would say in general, this is a big move in the health industry, is to have connection with the patient between doctor visits so that we can assure that patients are following up on what the doctor says, because one of the biggest problems in healthcare is compliance, which is everybody listens in the doctor's office and says, yes, I'll do it. And then they go home and life intervenes and it doesn't really happen. So this is
exactly.
So what's the difference between care management service and care coordination?
They're pretty much similar. Care coordination is a broader view of the whole patient-centered care service and the impact of those services. Care management are specifically things like, chronic care management, remote patient monitoring, behavioral health integration, the very specific services that Medicare incents, right?
If we could add on to that, kind of the care management services as mentioned before are really a bridge between the visits for the patient, but then care coordination can almost be seen as like a bridge between the providers, right? And so as it currently exists with healthcare, as it currently exists, it's incredibly disparate, a lot of, separate or siloed databases and things like that. So it's an opportunity to kind of connect those sources with the patient being at the middle of them.
Right. And if you don't mind my getting into the weeds for a minute, I understand there are 4 pillars to care management services. Can you discuss what those are so people, again, better understand what those are?
Sure. So first would be interoperability. As we just discussed, kind of the difference between care management services and care coordination services. The care coordination, again, is provider to provider with the patient being in the center, and data interoperability is key to that. It's important. The second would be engagement. As we began this, we talked about how, engaging patients is one thing, but having them continuously engage after they leave the office is another thing. But that's a huge focus because that engagement directly leads to adherence. Third would be clinical outcomes. All of this is really patient focused, and we want the patients to remain healthier. Right now, I think we're in a very reactive sort of industry, and we're moving towards, more prevention. So, clinical outcomes is definitely the third pillar and third focus for us. And then the fourth would be reducing clinical burnout overall. The last thing that we want to do and what we need to happen is for, providers to feel increasingly overwhelmed with all that they have going on caring for patients. So, our job is really to lighten that load, decrease that burden, and, mitigate some of those tasks that they currently have.
Yeah, and just to and maybe you can speak to this a little bit, but just to detail that a little bit, there's been such a trend in healthcare where there are specialties and there are not enough specialty providers. The idea is, well, let's push it to the primary care provider. He or she can do this and take over some of that work. And when you take a look at the primary care provider job, they've got so much that they're responsible for. And to talk about all the caseload with COVID these days and comorbidities or coexisting conditions, it's exhausting for the health professional. So your services are really to support, I understand, the providers themselves.
Exactly. And you think about it, if we've got care managers, care coaches that are engaged with the patients on a monthly basis, and sometimes, a couple of times a month,
yes,
depending on the patient's needs, right? That's information, that's data that's available to the provider at any time, right? And so we start to provide another level of support for that provider with these services.
So what is it that patients need to know about care management services? I mean, how well is this understood? What do people need to understand that they don't understand now?
Kind of a two-pronged answer. First, it's not very well understood from the provider perspective because it's incredibly underutilized industry-wide. Mm-hmm. So if the providers aren't understanding it, then the patients surely aren't understanding it. But what they should know or could know that could help is that, this industry is a consumer industry, much like any others, and they should feel empowered and feel accountable for their health and their decisions. So this is an opportunity to kind of regain that, not power, but that decision-making capability mm-hmm. over their health and the direction of their health in conjunction with, the experts like their PCP, for example.
And that's important because, the key to these programs is the patient engagement and the patient taking ownership. Mm-hmm. And so the partnership between the patient and the provider in establishing that care plan is critical. And the patient, having, full visibility to, expectations of being in the program and how they can be supported in it.
So, Eric, you mentioned before that this is really kind of an untapped market that both healthcare providers and patients are not very much aware of. And so what help can LevelHCS be to primary care providers? What kind of services do you provide that take that pressure off the primary care provider, but also provide services for the patient? And I think what you also mentioned before on interoperability, whatever programs you use, you want them to be able to integrate with the doctor's database and information so the doctor can see what the patient is doing and get the most information they can get. So tell us a little bit about how you grease the wheel.
The NFL playoffs are better with FanDuel because right now new customers can bet $5 and get $200 in bonus bets, guaranteed. That's $200 in bonus bets, win or lose. FanDuel, an official sportsbook partner of the NFL. 21 plus and present in select states. First online real money wager only. $5 first deposit required. Bonus issued as non-withdrawable bonus bets which expire 7 days after receipt. Restrictions apply. See terms at sportsbook.fanduel.com. Gambling problem? Call 1-800-GAMBLER.
So I think that's a big piece. The last part that you mentioned, the data interoperability, having that visibility, it's very difficult to make decisions in a vacuum, right? And so if we're going to have or be the most frequent touch point, often with a patient, providing that information back to a provider is key. So they have the ability to make decisions with more information than they would have prior to an engagement with us. Mm-hmm. Another piece I would say is, again, not only just patient engagement, but also re-engagement. So this is an opportunity to maybe tap into some of those patients that previously were maybe disenchanted with their experience, or, wait until something is, falling off or turning green before they go have it checked out.
Right.
It's an opportunity for them to be, again, a bit more proactive and preventive, which I think in turn providers would be incredibly pleased with seeing improved clinical outcomes overall. Then the third piece would be, I think, very tailored educational materials and information that they can provide not only to their staff but also to the patients, to let them know about these services.
Mm-hmm. And I think it's key for us, for example, We think it's very important for us as a service provider to, to help identify a approach for, how we meet those services. So, what we like to say is, this is a strategic initiative, and we want to be a part of defining how you accomplish the goals that's established for this strategic initiative. Each provider will have could potentially have different expectations of what they're want to get out of the program. And so we want to be a part of understanding that and helping design the model that best meets the needs for that provider. Right? Mm-hmm. And so if there's if we're implementing remote patient monitoring, right, who are the patients that's targeted for that? And so we work with the provider to understand and establish that program, and then determine what the solution is, right? What are the connected devices, if you will, that we need to provide for the patients? And that's all a joint effort, and identifying, defining the patients that should be in the program, and then what the solution for those patients can be.
Great. What are some things, and we just have a couple of minutes here left, but I wanted to get in this last question before we take a break. What are some things that healthcare centers can be doing right now in care management services?
I think the most important thing is, looking across your patient population. Right, what are the most impactful things that you can do? If you've got a high percentage of diabetics in your patient population, if you've got a high percentage of patients with multiple chronic conditions, mm-hmm. Identifying who those patients are, look at your risk stratification and determine, what things you want to do for those high risk patients, right? And so, and what we like to say is, we're not asking you to put every patient in the program, just those patients that should be in the program, right?
Right.
And you help determine, because Medicare's got, they've got criteria for who goes in the program, but you understand your patient population best. And so you decide which patients goes into the program from your perspective, right?
I'm just wondering, with all the providers that you talk to, how many of them have the time or the foresight to actually take an overview look at their patient population and kind of generalize, this population should be getting this kind of care and this population should be getting that kind of care? How many doctors have the time to do that?
Well, that's a great question. And I think,
Hey all, Jonathan from Go2Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go2Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GoToHealth at checkout. That's code GoToHealth at drinkspark.com. Let's tackle the day together with Spark Energy plus Focus.
Strategic approach. I'm not sure that happens, but a lot of them are forced into it, based on requests coming from the health centers, right, or from Medicare, and so they have to at some point look at that data. But a day-to-day reviewing and establishing a strategy around those patients, which is what we really like to do, right? I mean, we like to look at that Medicare population and provide some feedback, but we also need to see what the risk stratification is from that health center.
So that's a service that you provide, is helping an office or a practice take a look at who their patients are and deciding what services they need.
Yeah, exactly.
Good.
Or giving you the information to determine which services you think would best fit your patient population. Right? Yeah.
Great. Eric, you want to add to that?
I think just the last little piece, and Levi covered it very well. The last little piece is that there's also a shift or a move from fee-for-service to value-based, right? And so with that move from fee-for-service, which is focused primarily on volume, to simplify it, overly simplify it, to value, the goal will be to keep patients healthier. And so understanding, as Levi mentioned, understanding the patients that you're working with is going to be key. Having some sort of risk stratification is going to be key. Knowing, what gaps need to be closed prior to them, is going to be key. So the move overall of the industry in the direction of value-based, I think, is also why it's important, if not already, to start thinking, for providers to start thinking about how they should look at the data of their patients.
Great. Good. So we're talking with Levi Chris and Eric Giambacchese of LevelHCS Systems. We're going to take a short break, but when we come back, I want to talk with them both a little bit about value-based care and also more specifics on the services they provide to help your health professional, and help you stay in better health. So stay with us. We'll be right back after these messages.
Now you can take your favorite Voice America radio program with you anywhere. Sign up for our mobile app if you have an iPhone, Android, or Amazon Kindle. The Voice America interactive radio player powered by Aircast gives you the freedom to listen to any of our programs anywhere, live and on demand. No registration is required. Listen to your favorite Voice America hosts and discover new ones. Download the Voice America mobile app for your iPhone, Android, or Amazon Kindle, powered by Aircast. Visit the Apple App Store, Amazon, or Google Play.
You are listening to Go to Health Radio. To reach Jonathan Marks or his guest expert on the live program, call in to 1-866-472-5788. That's 1-866-472-5788. You may also send an email to jonathanmarks@gotohealthmedia.com. Now, back to this week's show.
Okay, we're back. This is Jonathan Marks with Go to Health, and we're with Levi Chris and Eric Giambacchese of LevelHCS Services. And in the last segment, Eric, you mentioned value-based care, and I think a lot of people don't really know what that is. Can you define that for us?
Sure. So I think the easiest way to kind of define it or explain it would be to juxtapose it with what the current model is, which would be, again, fee-for-service. Fee-for-service is essentially the volume for dollars, or you provide a service and you're reimbursed for those services. Again, with the shift moving away from fee-for-service to value-based care, value-based is more focused on keeping patients healthier. So if you have a cohort of patients, depending on the risk of those patients, you may be assumed to have to provide a certain level of care for them with that, let's say, pot of money. And so the incentive is for you to keep the patients healthier, keep them out of the hospital, the ED, and have more of a preventive approach to their care. So again, it's focused less on volume and more on the value to the patient that you're providing.
So are there bonuses or some kind of extra compensation, provided to providers who keep their patients healthy? How does this system work? If you don't mind explaining it a little bit, and I'm sure it's not easy.
Sure. There are so many different types of models. I mean, there's shared savings, there's, quality programs like MIPS, there's HEDIS score, there's a number of different measures, but in short, however you're incentivized, whether you are sharing in the savings of, maybe a capitated payment or a portion of money that you're given to care for a cohort of patients, or if you are kind of taking full risk, for a cohort of patients, and then you're, either reimbursed or penalized at the end of the year, depending on how well you cared for those patients. So there are a number of different models, but all of it is really focused and hinging on how well you take care of those patients while you have them.
Got it. And do we think this is a good move in healthcare, and why?
I think it's a good move. I think it's a good move because it's healthcare and not sick care, right? And so the whole focus is to keep people healthier. And, if the approach is to kind of catch things before they happen, and we have access to so much data and so much technology, and with AI and all of these things, it's incredibly possible for us to, move in the direction where we're able to, again, be very preventive or proactive about certain things. I think this is the best move.
Great. Levi, anything to add to that?
I agree with Eric there. And it's a challenge transitioning, right? I mean, and this is, one of the challenges with, implementing the care management services is that now, the fee for service is still, kind of the model that's used for the most part, and that transition, will take place. And so being proactive and get into that, that model is somewhat of a challenge. Everybody knows it needs to be done, right? But, just moving there, right? And especially, with COVID tests, COVID vaccines, everything that's taken up the time of patients and the providers. It's hard to focus on these types of things. So, the planning effort and the initiative, to start moving in this direction, we think will eventually come up. And what we'd like to do is just be a part of that planning process and help the health centers, the providers, get there sooner, right?
Good. So this leads beautifully into my next question, which is, what made you all start Level Healthcare, and how did you all get together?
This podcast is sponsored by Talkspace. When you're really stressed or not feeling so great about your life or about yourself, talking to someone who understands can really help. But who is that person? How do you find them? Where do you even start? Talkspace. Talkspace makes it easy to get the support you need. With Talkspace, you can go online, answer a few questions about your preferences, and be matched with a therapist. And because you'll meet your therapist online, you don't have to take time off work or arrange childcare. You'll meet on your schedule, wherever you feel most at ease. If you're depressed, stressed, struggling with a relationship, or if you want some counseling for you and your partner, or just need a little extra one-on-one support, Talkspace is here for you. Plus, Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance? No problem. Now get $80 off of your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
Well, I would say that we all have this same view, same vision around just being a part of helping address some of the challenges in healthcare. We feel like the care management services is a way to really touch the healthcare community, because you deal with patients, you deal with providers, as well as the health centers. For us, as we go into a client and we understand the provider, the doctor, the patients, we also need to understand the community and what's available in that community for those patients. And so pulling all of those together, I think, is really one of the things that kind of spawned us to really levitate to this space. I worked in this space. This was back in 2017, and there was a lot of. It was an early time to be in this space, and the adoption was slow then as well. But it incented me to be a part of to build this organization.
Yeah.
And then Eric's worked in this space as well.
Right. So when you work with a health practice and their clients and their patients, what's your vision of success? What does success look like?
For me, it's the patient engagement, right? Meaning that we're showing some value to the patients.
Mm-hmm.
It's the satisfaction of our clients, right? The providers are seeing value in what we do, right? And we've got a good, solid process, a good, constant way of onboarding patients. I mean, these services become part of the foundation of that health center or that provider's practice. Right?
Yeah, so I know in most doctor offices, and Eric, I'll let you chime in here, but I know in most doctor's offices, their objective is to see a patient every 15 minutes, right? Or 20 minutes max. And it's just going from one to the next, to the next, to the next. And, how much depth can you really get into? And what I'm hearing is Level Healthcare Services really does engage with the patient through different programs in between doctor office visits so that there can really be better follow-up and, as you were saying, more patient engagement. Eric, did you want to add to what Levi said?
Essentially the quadruple aim, right? So we're keeping patients healthier, we're reducing provider burnout, we're providing a cost savings, but then also hopefully not disrupting, the provider services as they currently exist. As you just mentioned, they have certain quotas that they try to meet in a day, so we don't want to disrupt that too much either.
Right. So how do you achieve cost savings for the doctor's office? Hey all, Jonathan from GoToHealth. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For GoToHealth listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GoToHealth at checkout. That's code GoToHealth at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
So the cost savings is more system-wide or industry-wide, depending on the model of a provider. If they're in an ACO, for example, they're incentivized to, again, kind of keep the patients healthier, but keep them within a system. So anytime that a patient goes to the emergency room for something that could be potentially avoidable,
right,
that's a cost strain on the system. So the whole goal is to really avoid that, and having that constant communication or engagement with the patient makes that significantly easier.
Mm-hmm. Okay. And tell me, I know you have a focus on what's your commitment to making a difference in underserved communities. That was a big topic in this year's Health 2.0 conference, was accessibility to care, which is how many people don't live near the specialist office or don't live near a pharmacy, or it's a big issue, which is accessibility to care. So what's your commitment to making a difference in underserved communities?
I think our approach, the model serves the underserved community well. So as we look at our target audience, rural health, federally qualified health centers, even some of the urban center facilities, having a focus on those patients and being able to integrate those patients into the program. Again, we know the communities, we know what the needs of the communities are, what's available in the community. And so now we can start to look for resources that patients may not be aware of. Right? So, and Eric, you may want to add to that.
Well, I'd say traditionally, the underserved communities are the ones that typically, have or receive fewer healthcare services overall. They face a number of challenges that may prevent them or serve as barriers for them to, receive or have access to care. Economic challenges, cultural barriers, language, religion, a number of things. And again, with our approach being engaging patients and meeting patients where they are, we like to understand those barriers and address those barriers, which again can kind of ease the relationship and facilitate the care or access to care that they would have with their PCP.
Okay. And there's a term called social determinants of healthcare. And we discussed what that means and how that fits into your goal of making a difference in underserved communities.
Go ahead, Eric.
So, sure. So again, in short, social determinants of health and the way that we view them, to sum it up, is meeting people where they are. So everyone has barriers. Everyone has, again, kind of what I mentioned before with, economic challenges or, religious differences, cultural things, language barriers, where you live. Any of those things play a factor, play a role in your health. And actually 80%, of things that directly impact your health are not related to health at all. It's those social determinants. So by addressing those, you're limiting or kind of mitigating, again, some of those barriers, decreasing those barriers to improve and increase access to healthcare overall, keeping people healthier and reducing the cost on the system overall.
Yeah, so give me an example of some of those social determinants so we're really clear about what that means.
Okay. So I'd say walkability, so where you live. If, a patient is from a lower income area and they don't have sidewalks, but they hear from their provider that they should exercise more or walk more, but there's no sidewalks for them to walk, what are they to do? Or economically, they have a job and they're paycheck to paycheck. They may have 3 dependents and they have to make a decision between, meal, gas, or medication.
Right.
Which one do they choose? So understanding some of those complex situations and helping navigate, those individuals to resources to, again, kind of facilitate access and improve healthcare or clinical outcomes.
Good. Great. Good. So let's talk about the specifics of some of the programs that you can help patients and doctors with. What services can you provide for patient engagement? Just some examples so we know the breadth of what you guys can do in helping both doctors and patients with follow-up.
So the annual wellness visit, for example, is it's an assessment, right? And every Medicare patient should have the annual wellness visit. And so our platform simplifies that annual wellness visit. We have a platform generated questionnaire or interview process, basically that leads the medical assistant or the care coach through a series of questions that result in the answers needed, all the documentation needed for that annual wellness visit. So the health risk assessment is interview guided process. The creation of the care plan is an interview guided process. So we we simplified that process in ensuring that all of the appropriate documentation is available at the end of the process to a point that you can submit a claim to Medicare. And so from the annual wellness visit, identifying where those patients should be based on the health risk assessment. Every patient should not be in these programs, but the annual wellness visit, every patient should have, right? Mm-hmm. And then that informs providers of which patients should be in chronic care management, okay? Which patient should be in remote patient monitoring, which patients should be in the behavioral health integration process. Mm-hmm. And so our platform helps provide the information to inform the doctors and that. For chronic care management, we will provide care coaches based on that care plan. Our care coaches will support the patients throughout the process. They'll make the calls to the patients on a monthly basis, provide feedback to the provider as required. But all of that information is available in our platform for the patients, for the providers, right? For remote patient monitoring, we provide the connected devices, if you will, the glucose monitors, weight scales, blood pressure monitors, and the devices we provide are cellular. So if you're in a situation where you don't have internet, that's not necessary with our product. And so we make sure that it's available for the patients regardless of whether or not they have internet. So, the other area is for the transitional management. Right? When patients go into the hospitals and come out, the opportunity to follow up with those patients and ensure that they get back to the provider, see a provider after they're released from the hospital. Mm-hmm. Transitional care management. So all of those programs, we provide the care coaches, we provide the medical assistants to do the follow-up, the outreach with those patients.
Okay, so I'm listening to all these services and I'm thinking here, how much as a patient is this going to cost me? Can I afford this?
Yeah. There's potentially a copay associated, and depending on the coverage you have, if you have a secondary coverage, then there's that could be covered as well. But there could be a copay associated with the services.
Got it. But if depending on my coverage, it might be totally free.
That's correct. Yes.
Good.
Yeah.
And then what does this cost the doctor? Is there a barrier for a doctor to start engaging with you and collaborating and using these programs? How does that work?
It's all covered by the Medicare reimbursement.
Okay. So really, this is just, you folks are really trying to connect doctors and their patients with more efficient follow-up programs and health coaches. And you're telling me this can all be covered by Medicare for the most part, except maybe for a copay.
Exactly.
Great. So give me the list. If I'm a patient who has X, what kind of programs do you have continuous care for? Tell me that list so I understand who can benefit from this.
So it's really, again, depending on the program, but if you have a chronic condition that is expected to last longer than 12 months, and if you have a chronic condition, let's say diabetes, hypertension, CHF, any of these things, they're expected to last longer than 12 months, then you would be, a good candidate for this program. Mm-hmm. The list is truly exhaustive, or not exhaustive that I just gave, but it's pretty long.
Let's say obesity.
Yeah, obesity.
Yeah, covered. Okay. Chronic health, obesity, chronic heart failure, you said, diabetes,
hypertension, diabetes,
right?
Are things like even arthritis, for example, dementia. There are a number of diagnoses that are covered.
Great, good. Good. So this is really something that a lot of patients and a lot of doctors don't know about. And you folks are here to make these programs available. And again, it's at virtually no cost to the patient and no cost to the doctor. They get reimbursed for these services.
And I wouldn't say a lot of doctors don't know about. It's the implementation that really challenges the doctors. How do I do all of this, right? And that's really the value that we'd like to bring to the providers.
So we're going to take another break. We'll be back in just a moment with Levi Chris and Eric Chiambakeza from Level Healthcare Solutions. That's LevelHCS.com. And in our next segment, we're going to talk about how you can get in touch with Level HCS to learn more about their services and benefit, whether you are a healthcare provider or perhaps a patient who wants to get those kind of services into their doctor's practices. As a patient, you could bring that information to your doctor. So we'll be right back after these messages. Stay with us. This is Jonathan Marks with Go to Health.
Listen for Go to Health Radio, featuring host Jonathan Marks and health experts from around the world who bring evidence-based education from Western, alternative, and holistic practices. We bring together you, seeking relevant and proven information for your healthcare needs, and reputable healthcare experts and companies who offer quality education for your benefit. Monthly, we also share continuing education for medical professionals. Listen live every Wednesday at 12 noon Pacific Time and 3 p.m. Eastern Time on Voice America Variety.
Hey all, Jonathan from Go to Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go to Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GoToHealth at checkout. That's code GoToHealth at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
You are listening to Go to Health Radio. To reach Jonathan Marks or his guest expert on the live program, call in to 1-866-472-5788. That's 1-866-472-5788. You may also send an email to jonathanmarks@gotohealthmedia.com. Now, back to this week's show.
Okay, welcome back to Go to Health. This is Jonathan Marks, and we're talking today with Levi Chris and Eric Chiambakeza from LevelHCS.com. That's LevelHealthcareSystems.com. And what they do is provide supportive, engaging services to doctors' offices so that patients can really improve their health on a continual basis, on a day-to-day basis, through software programs and also health coaching. And so Levi and Eric partner with doctors' offices to help them keep you healthy. So the first question I want to ask, guys, is if somebody wants to get in touch with you, your website is levelhcs.com. But what's the best way to get in touch with you if they're interested as a doctor's office in having your service? Or I want to even suggest to the patients listening to this, if your doctor doesn't have a program for your chronic care management, I'd like to suggest that you tell them about LevelHCS so that they can start taking advantage of these programs. So how do people get in touch with you? What's the best way?
The best way is send an email to info@levelhcs.com. We will follow up with you as soon as possible.
Great. So if your doctor, again, if you're a patient listening and your doctor does not have managed care services, you want to tell them about LevelHCS because they can help. LevelHCS can help get the doctor's office involved with these engaging programs, and tell them who your doctor is and maybe even their phone number or their email address so that LevelHCS can reach out to the doctor if that'll work. So tell me a little bit, guys, about when a doctor decides to come on with your program and work with you as a partner. What's the onboarding process? How difficult is this? How easy is it? What are the steps that practices go through to get engaged with you?
So the very first thing we would do is sit down and just get understanding of the patient population. What are the goals of the provider? Is there a certain segment of the populations that they want to address? But building that understanding of what's important to that provider or the health center. Secondly, how do we integrate with the existing workflows? The last thing we want to do is, add unnecessary steps to their workload. And so how do we integrate the workflows with things like, notifying, how do you want to be notified of a patient that needs a prescription filled or something as simple as that. So how do we communicate to your office when there's a need to notify you about the patient, right? Mm-hmm. And so understanding that, and then it's always important to have that champion, if you will, right? And someone that's working with this, monitoring the value that we bring in, someone that's held accountable, someone that's accountable for ensuring that we deliver what we need. So who is that champion that we want to work with, right?
In the doctor's office, you're talking about?
In the doctor's office, right?
Got it. Okay, good. Mm-hmm. So you talked about the advocate in the doctor's office. How much is Level Healthcare System or Solutions and your coaches, how much are you folks advocates for patient healthcare?
Yeah. So I think that's really the key to our services, right? Our care coaches, are there to ensure that the patients are meeting their goals and giving them every resource they need to meet the goals. Mm-hmm. And so I guess a good name for the care coaches could be the patient advocate, right? Because mm-hmm. that's their role, that's their job,
right?
Is, to advocate for the patient, get back to the doctor's office when the patient may have an episode or patients just, got questions, right? Make sure that the communication's there, right? Mm-hmm. And that's why it's important for us to have laid out how we communicate with each other so it's not a disruption to the office, right?
Got it. And how much are you guys on the lookout for new technologies or new monitoring systems to bring into your practice so that you can improve healthcare? So for example, I just recently interviewed an upstart company that is monitoring. They have a phone app which monitors your multiple sclerosis symptoms. That's something you may not know about, but how much are you on the lookout for surveying the scene to see what new services can we bring to patients? What's that function there?
And it's something that we are constantly looking at. Mm-hmm. I get probably 2 to 3 invites or emails a week on new technology that's coming up, new services that are available. And so it's something that's key to us, right?
Got it. Good.
Just like with with the patients though, like not every patient may be a good fit. Also, not every device or piece of technology would be a good fit either. We're also huge on ensuring that we don't increase any barriers. So if again that device or technology is something that we don't feel would necessarily mesh well with the population we're working with, and I'd just say that's something that we take into consideration too. But we're always on the lookout.
Good. So when you're working with doctors' offices, you're integrating your services and possibly with their services or their referrals. Can you tell us what are some of the top barriers for successful care coordination these days?
The most critical is patient engagement, right? And having patients that are truly focused on on the patient-centered care model, the care plans, and then having care coaches that are have that engaging personality, right? That, it's important to make sure that as you look at the patient populations, that you've got the right resources for the care coaches. Right?
Got it. And as you grow with more and more healthcare practices, I'm assuming you bring on more staff to handle the target conditions that you want to be able to serve your population with.
That's right. The conditions, as well as the geography. Right.
As mentioned earlier, one of the key barriers could also be like health literacy. If there's educational materials, or if again, a patient speaks a language that's not a primary language in that office, that could serve as a barrier. So, as we grow and increase our footprint nationally, we would obviously like to have the, care coaches or the staff to support and relate to the practice, but also the patients that we're going to help serve.
Good. And in these last few minutes here, let me just ask, are there particular types of healthcare practices that you're targeting that you can best serve? Can you tell me about those? Who are you reaching out to in the healthcare community that would be best served by your services?
Primary care providers are, the targeted audience, and they could be, private practice. It could be FQHC or federally qualified health center.
And then also health centers, organizations where this is important to them. So the ones that understand kind of the direction of where we're going, where healthcare is going, and that's something that they find should be essential or pivotal, in their strategic plan moving forward.
Great. And I want to tease you a little bit there, Eric. Where is healthcare going? Give me an overview here. What you had in mind when you said that.
Yeah. So, I'd say again, so from fee for service to value based, but we're moving from reactive, which is kind of how we are now, to proactive, to ultimately preventive. And, as we increase again, this data interoperability, having, increased insights as to, what a demographic looks like, what a patient looks like, when they're not in the office, that allows for improved clinical decision making, right? And so moving from reactive to proactive to ultimately preventive is where we see the industry moving.
Great. And I would also add, and you've said it in there, I think another important component there is patient engagement and patient, I would say, responsibility for your own healthcare, right? Because the doctor can tell you lots of things, but if you don't do anything about it, it wasn't much help.
Yeah, exactly. Yeah.
And so I think a lot of the programs that you are talking about really encourage patient engagement and working with a health coach who's knowledgeable, and potentially health software that is, measuring symptoms or symptom levels. So it really is more up to the patient about how they're doing. And it's a big responsibility each patient has on his or her part.
Yeah. Not only does it encourage that patient engagement, it relies on it.
And say more about that. How so?
As you said, this doesn't work without the patient doing something. And, when care plans are created, they're not created for them. They're created with them, understanding those barriers, understanding their social determinants, understanding what their goals are. Because if you know what a patient or a person's goals are, that's meaningful to them, they're more likely to buy in, more likely to adhere and remain engaged.
Yeah. So it really sounds very customized to the patient, doesn't it?
Yes.
Absolutely.
What is it the patient, and then that goes back to the patient plan that the doctor develops, and you help them develop that plan. And so that can really speak to the programs they get involved in, the coaching they get involved in is really specific and customized toward them.
Yeah. And I would say, there are things that the doctor, want in that plan that are fundamental, right? Now, how the patient chooses to address those, there's coaching from the doctor, but also our care coaches are helping them to evolve that, right? So this is what the doctor said you need to focus on. And so how are we going to do that, right?
Got it. Good. Okay. Well, thank you very much. So we've been talking with Levi Chris and Eric Chiambakeza. They are from Level Healthcare Solutions. Their website is LevelHCS.com. And if you want to get in touch with them, and I encourage you to do so, their email address is info@levelhcs.com. And the takeaway, guys, that I'm thinking of here is that you are really embodying this new movement in healthcare, which is having more continuous care for patients and enabling that. So it's not just the doctor's visit, but really what does the patient do when they go home? How do they live a new lifestyle? How do they get empowered so that they can take care of themselves in what you've described as really a customized care program for them? So that you've reviewed it with the doctor and you decide what programs they're going to go into, and then you keep the patient engaged between doctor visits and report that information and results and outcomes to the doctor so the doctor can take better care of the patient.
Exactly.
Right.
Good. Well, I got it, and I hope our audience got it. And again, we're talking with Levi Chris and Eric Chiambakeza from LevelHCS.com. I encourage you to get in touch with them, especially if you have a chronic disease or chronic disorder. If you're on Medicare, these services are basically for free. If you have Medicare coverage or supplemental coverage, there may be a copay to some of LevelHCS's services, but it's really worth looking into and getting your doctor. Tell your doctor, I want my Level Healthcare, and have them go to LevelHCS.com and get signed up with these guys, and you'll be in better health. Eric and Levi, thanks so much for being with us today. Really appreciate it, and that the work you're doing, and especially in underserved communities, which is so important. That's such a focus on healthcare going forward, is getting healthcare in the hands of more people, so that, as you said, Eric, we're not being reactive, but we're being proactive and eventually preventative.
Americans love using their credit cards, the most secure and hassle-free way to pay. But DC politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com.
Thanks very much, guys, for being on. Really appreciate it.
Thank you, Jonathan.
Thank you for having us.
Thank you for having us.
And so to my audience, it's great being with you again. You can join us online, and you can watch us at gotohealthmedia.com. We have all our videos there. You can listen to us on 7 podcast networks. You can also listen to us on Voice America Radio. And if you'd like to get a schedule for future and upcoming shows, or to catch up on previous shows, and we've got a lot of good ones, you just go to gotohealthmedia.com and click Get Updates, and you can sign in a form, tell us a little bit about who you are, and then you can get emails from us. So till next week, this is Jonathan Marks with Go to Health Media, and remember, everybody, go to health. Thanks again, Levi and Eric. Good to be with you. We'll see you again next week, everybody. Take care.
Thank you.
Bye-bye.
Thank you.
Hey all, Jonathan from Go to Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go to Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GOTOHEALTH at checkout. That's code GOTOHEALTH at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
Thank you for tuning in this week to Go to Health Radio. Be sure to join Jonathan Marks and another health expert next Wednesday at 3 p.m. Eastern Time and 12 noon Pacific Time on the Voice America Variety Channel. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.
Americans love using their credit cards, the most secure and hassle-free way to pay. But D.C. politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com.